The coronavirus continues to take new countries under its radar each day, and the epicenter seems to be shifting. The World Health Organization has said that the United States could be emerging as the new epicenter. In the last 24 hours, 40% of the cases recorded worldwide have been confirmed as coming in from the United States alone. The country has recorded over 59,900 cases of coronavirus and more than 800 people have lost their lives. New York, the city mayor has called his state the epicenter of the outbreak in the United States. The city of New York has about 1/3 of the cases confirmed across the country. We are getting two very conflicting narratives at this point from America. On one hand, we have President Donald Trump, who says that the U.S. will defeat the virus by mid-April. On the other hand, we have the mayor and the governor of New York, who have said that the month of April may be worse than what is happening right now. The U.S. Senate has agreed on a $2 trillion stimulus package. The relief bill aims to provide a $1,000 check to the affected citizens. Leaders of both the White House and the Senate have also struck an agreement over the proposed package. This to address the economic fallout from the pandemic. William Denslow, correspondent, joining us now from New York. William, hi. If you can first tell us more about what the situation on the ground is looking like in terms of the latest figures.
Absolutely. Looking at New York specifically, we've just heard from the Mayor of New York State, Andrew Cuomo, delivering a press conference in Albany. He's given a quick update on the figures out of New York State, of course, as you rightly say, really seen as the hotbed now in the US when it comes to COVID-19 cases. He's come out and said that the problem in New York State is around 10 times worse than any other state in the country. He says that now over 30,000 cases of COVID-19 in the state, 5,000 new cases. He says the death toll has surpassed 280 in New York State alone. He says that the trajectory that this outbreak spread is on is that every 3 days cases are doubling. That's an incredibly concerning move for New York State, and he warns that New York is the canary in the coal mine and that what happens in New York could very well happen elsewhere in the country. Andrew Cuomo has said that there are simply not enough supplies at the moment. Namely, he points to several key issues: beds and also ventilators. He said that he will be doing all he can to try and get more beds available, things like converting university campuses, even nursing homes, even possibly hotels into extra beds to try and equip them to cope with the potential surge. Of course, you very correctly alluded to it, but he warns that in 21 days we could see an apex of cases in New York. He's very much called on the federal government to keep doing all they can to keep supplying medical supplies to New York as really the city hunkers down and braces for potentially the worst of it that is just a matter of weeks away.
Right, William, and in sharp contrast, the narrative put forth by the American president seems to suggest that everything is under control. He, in fact, wants people to return to work by Easter, that's mid-April. A lot of criticism coming the president's way earlier on as well about suggesting a possible cure for the disease. Give us a better sense of the reactions that have come in so far from within the White House.
Well, the message from President Trump is that the cure to the coronavirus outbreak can't be worse than the disease itself. He says that there could be even bigger harm. He's even alluded to the fact there could be more deaths as a result of the economic pain caused by these nationwide shutdowns than caused by COVID-19 itself. So he's mentioned that he wants to see the economy start to open up, as you rightly mentioned, by potentially Easter, so potentially in just a few weeks in the middle of April. However, of course, that coincides very nicely with the New York governor's estimates that we could be reaching an apex of cases here in New York, and then that could mean more and more cases further down the line in other states in the US as well. So there's a real concern. Now, we've heard from New York's Governor Andrew Cuomo really addressing these, what two seem to be contrary points of view. He said that if the American people are given a choice between public health and opening the economy up and more economic expansion, he says that the American people will choose safety and choose public health every single time. However, he does say that there is the potential to reach some kind of a compromise if things are done smartly when it comes to those who have already had COVID-19, those that are less of a risk, younger populations potentially that aren't showing any symptoms. They could slowly be returned to the workforce, but he warns that this needs to be done in a very deliberate, very careful manner, because the concern is if you start to reopen the economy, that could potentially undermine all these efforts of flattening this curve, and we could see COVID-19 outbreaks really continue to rise unabated. So that's a huge balancing act that both the federal government and local governments in the US are trying to get right.
Right, and the president's message overall has been that of prioritizing saving the economy in a way over saving lives. We're going to leave it there for the moment, William. Appreciate very much joining us with those details and perspectives.